So chapter 4 is a long chapter, and we're going to kind of breeze through it because we're taking this course more from a psychosocial approach than a biological one. So anyway, we'll touch the major points, including the title of this chapter. It's on prenatal development and birth, all of which, as a fellow, I'm not really too familiar with because I've never had children, although I've experienced the joy of participating in that. Prenatal growth happens in three main periods: the germinal period, first 2 weeks after conception, rapid cell division, and beginning of cell differentiation, the embryonic period, which is the 3rd through the 8th week. Its basic forms of all body structures develop, and the third period, the fetal period, 9 weeks on the 9th week until birth. The fetus grows in size and matures in functioning. During the germinal period, the first 14 days, the zygote begins duplication and division within hours after conception. You see the development of the placenta, the implantation about 10 days after conception, and the organism grows rapidly. There are different vulnerabilities during the prenatal stages. During the germinal phase, about half of all conceptions fail to grow or implant properly, and thus do not survive the germinal period. Most of these organisms are grossly abnormal. During the embryonic period, about 20% of all embryos are aborted spontaneously, most often because of chromosomal abnormalities. During the fetal period, about 5% of all fetuses are aborted spontaneously before viability at 22 weeks, or stillborn, defined as born dead after 22 weeks. And of course, birth, about 3.1% or 31% of all zygotes grow and survive to become newborn babies. You can see that the survivability is going up as the stages progress. The embryonic period from the 3rd through the 8th week, the embryo's primitive streak develops. This becomes a neural tube and later forms a brain and spinal cord and the central nervous system. Head takes shape, eyes, ears, nose, and mouth form. The heart begins to pulsate, and extremities develop, and webbed fingers and toes separate. So it gives you some idea when a person has some developmental delays where they're at embryonically if they still have webbed feet and hands. Here's some images of the embryonic period, 4 weeks past conception, 7 weeks past conception. Interestingly enough, if one were to go and look at other organisms, including any animal with a spinal cord, you would notice some very similar kinds of things, that they pretty much look the same. During the fetal period, 9th week after conception until birth, the genitals form. Sex hormones cause differentiation of brain organization. Cephalocaudal and proximal distal development, that is that you develop from the head to the tail and from the center of the body to the fingertips. Heartbeat is detectable with a stethoscope. Cortex, that's the cerebral cortex, is not fully mature at birth. And the brain at birth is the biggest part of the infant body. Fetus from 9th week till birth, the imaging is absolutely amazing. During the 3rd month, rapid growth with considerable variation. On average, at 3 months, they weigh about 3 ounces and are about 3 inches long. By the 9th week, SRY gene triggers development of the sex organs, and by the 3rd month, neurological sex differences begin. The fetus in the middle 3 months, the digestive and excretory systems develop. Fingernails, toenails, and buds for teeth form, and hair grows, including eyelashes. In the middle 3 months, the brain experiences rapid growth. Follows proximal distal sequencing from the brainstem to the midbrain to the cortex. Develops many new neurons called neurogenesis, and many new synapses called synaptogenesis. The key word, root of the word, is genesis. Begins to regulate basic body functions such as entire nervous system becomes responsive. This image just shows you essentially the development of the neural tube. The fetus in the final 3 months involves expansion and contraction of lungs, includes final maturation of heart valves, arteries, and veins, and provides time for extensive growth and folding of the cerebral cortex. At birth, the fetal brain signals the release of hormones to trigger the female's uterine muscles. Labor begins. Average duration for the firstborn is about 12 hours. Quicker labors for later born babies or multiple babies. Birthing positions vary from sitting to squatting to lying down to water births. And a lot of this has to do with personal preferences, at least in Western culture, and some cultural practices as well. This just depicts a normal, uncomplicated birth. During the newborn's first few minutes, they usually cry spontaneously. Their color changes from bluish to pinkish, that is, they're getting more oxygen. Their eyes open, their fingertips grab, and their toes stretch. This is all measured on something called the Apgar scale, which is a quick assessment of the newborn's heart rate, breathing, muscle tone, color, and reflexes. Completed twice, at 1 minute and at 5 minutes after birth. The scores range from 0 to 1 to 2 in each category. Typically, you're looking for a desired score of 7 or above. And this just gives you an assessment of what APGAR means. Sometimes there's a need for medical assistance, depending on the parent's preparation, the position and size of the fetus, and customs or of the culture that you live in. In most developed nations, they include sterile procedures, electronic monitoring, and drugs to dull pain and speed up contractions. It's fairly common. They also include surgery and epidurals, which is an injection in a particular part of the spine to alleviate pain. It's often used in hospital births. It increases the rate. There's also been an increase in the rate of cesarean sections and a decrease in readiness of the newborn infant to nurse. And of course, they can also always induce labor, which involves administering drugs to start speed or strengthen labor. The increased rate is now at about 20% of all U.S. births. Cesarean sections are controversial, to say the least. Involve surgical births, vary by rates and reasons for use. But they do present some advantages, especially for hospitals, especially with more complicated births. There are alternatives to hospital technology, including home births. There are individuals that specialize in the delivery and care for babies after they're born, called doulas. Typically, it's a woman who helps with labor, delivery, and breastfeeding, and newborn care. They may be related to lower rates of cesarean section. And just like anyone who helps deliver babies, like midwives, not all doulas are as good as one another. So some have quite a good reputation and some don't. There are problems that happen during labor, though, and the growth of the baby, and these include what are called teratogens. Some harmful substances are prenatal, that is, they're agents or conditions that include viruses, drugs that result in birth defects or complications. A good example of this would be the German measles. You can have behavioral teratogens too, that is what the mother's doing. Agents or conditions that can harm the prenatal brain, impairing the future child's intellectual development and emotional functioning. This might include things like fetal alcohol syndrome, where the mother drinks, that's the behavior, while she's pregnant. One of the things that pediatricians and healthcare experts like to do is a risk analysis that discerns which chances are worth taking and which aren't. Sometimes there's a critical period, for example, consuming alcohol that has more of a risk than other times. The dose and frequency is also something that is taken into consideration. And then, of course, the innate vulnerability. There are critical periods in human development. You'll notice that the green is highly critical and the purple is not quite as critical. And you can see that the periods correspond with the stages of development above those. And of course, it all boils down to the question is how much is too much? There is a threshold effect. Certain teratogens are relatively harmless unless exposure reaches a certain level. So if you were around someone who's smoking a cigarette, the smoke might be, of course, cumulative, might be bad, but in one episode may not be all that bad. And another example would be alcohol consumption. This is one that goes back and forth over the years. It's something that's totally under the control of the mother, whether or not she drinks or she's around people that drink. Risk analysis also looks at innate vulnerability, which in effect is the genetic vulnerability. Some zygotes carry genes that make them vulnerable. Male fetuses are more vulnerable to teratogens than females are. The mother's genes affect the prenatal environment far more than the father's genes because she's carrying the fetus around. And of course, there are examples of that, including neural tube defects like spina bifida, and some that are more common in different ethnic groups like the Irish and English, and certain Egyptian groups of people. Things that you can do before pregnancy is pretty self-explanatory. What prospective mothers should do and what they really do. There's always a gap between what people want to do and what they actually end up doing. It's worth reading through. And those of you that, if any of you have had babies, can probably relate to what's on the list. Risk analysis is also tied to what research shows. So sometimes there's advice from scientists that differs from advice from doctors. So the advice from doctors is a provision of potentially dangerous prescriptions to pregnant women and failure to take time to understand a woman's life patterns. That could be a risk, whereas scientists, on the other hand, is the provision of contradictory interpretation of research that lead to opposite messages. So this involves the potential mother, to be aware of some of these controversies and have to make some of the decisions for themselves as well. Prenatal diagnosis is a tricky business. Early care protects the fetus growth, makes the birth easier, and renders parents better able to cope. So for example, if the mother exercises regularly and takes care of herself, it's going to have an impact on whether or not there's complications. When complications arise, early recognition increases the chance of a healthy birth. About 20% of all early pregnancy tests raise anxiety instead of reducing it. And by the way, those are called false positives. Low birth weight can happen as well, mostly affected by the maternal behavior, the mom's health, and whether she's healthy or engaged in healthy behaviors. Mother's drug use before and during pregnancy are other examples. And then, of course, is the mother taking care of herself? It's not just the mother, but also the father as well. Those things are pretty important. What about the father? There's some evidence that indirect risk effects can have an adverse outcome, especially when you consider the father's attitude about the child or about being healthy, or the mother being healthy, the relationship between the mother and the father, if it tends to be conflictual, and of course, the risks involved in some Hispanic families, which they talk about in the textbook. Low birth weights compared by nations. The United States has a low birth weight rate of about 8.2%, ranking worst among the developed nations of the world. Essentially, American mothers are less likely to take care of themselves and thus have lower birth weight compared to other mothers from Western cultures. Worldwide, far fewer lower birth weight babies are born today than 20 years ago, and that's been the trend. Neonatal deaths have been reduced by 1/3 as a result, which is really great news. But even within a culture like the United States, or a country like the United States, there's variability from one ethnic and racial group to another. There are consequences to low birth weight, including the high-risk infants and children. They're later to smile, later to hold a bottle, later to walk, and to communicate. In middle childhood, former SGA children have smaller brain volumes. Remember, the risk analysis gives odds, not certainties. So while it may be predictive in some ways, it may have limitations as well. There are complications during birth. When a fetus is at risk, birth complications become more likely. So for example, cerebral palsy is an example of a complication that happens during the delivery process. Anoxia related damage related to not getting enough oxygen can be caused by other issues like the birth weight of the fetus. If there are genetic issues, it's gestational age, how far along in the pregnancy are they, and the types of drugs in the bloodstream. Of course, the new family, no one's ever really quite prepared for, even though you've been waiting 9 months for it to happen. Newborns seek to protect themselves with 3 sets of reflexes that I've included some videos in the learning material, including maintaining oxygen as one. So that is, they breathe and hiccup and sneeze. Maintaining a constant body temperature. Often that's the cause of crying or shivering, or tucking legs up into a ball, or pushing away. And the third important set of reflexes is managing feeding, which includes sucking, rooting, and swallowing. Keep in mind now that reflexes are inborn into the nervous system. You don't have to teach a reflex. They're just there. T. Barry Brazelton developed the Brazelton Neonatal Behavioral Assessment. It's used across the country. It's a test often administered to newborns that measure responsiveness and records 46 behaviors, including 20 reflexes. Parents who watch their infant perform on the neonatal behavioral assessment scale are amazed at the newborn's responses. And this fosters early parent-child connections, which is super important. Other reflexes are not necessary for survival, but significantly or signify the state of brain and body function. um, including the Babinski reflex. If you watch the video, you can see how they do that. The stepping reflex. These are with newborns, by the way. The palmar grasp reflex, and of course the Morrow reflex. Be sure to watch that. Fathers do have an important role, though. Not all fathers, but the entire social network and culture are crucial influences. It's been for many, many years believed that the father was less critical than the mother, and in some ways that's true, but father's role can't be underestimated. One of the things that they do is help mothers stay healthy by promoting healthy behaviors with mother, helping mothers manage stress, pitching in, being there, providing legal acceptance at the birth. So fathers are really important, and they will be throughout the life of the child. Kuvad, by the way, is a symptom of pregnancy at birth that are experienced by fathers. That's not a typo, it's by fathers. So it's like a false pregnancy or a sympathy pregnancy. It's not that unusual, and it does happen. Is the father pregnant? Of course not. But they go through, in a sense, this kind of sympathy with the mother. About half of all women experience physical problems at birth. Between 8 and 15% of women experience postpartum depression. You may know someone who's had this. It can be incapacitating. Feelings of intense sadness and inadequacy, symptoms from baby blues to postpartum psychosis, which means that the woman's not able to function. It may involve struggles with adequate baby care, and the truth of the matter is nobody really knows what caused it. But there are opportunities and methods to treat it. Something that can help is to create parental alliances, which involves commitment by both parents to cooperate in raising the child. Not only parental alliances within a marriage or within a family, but between couples. It's always good to have friends that have children to support each other. It's especially beneficial when the infant is physically vulnerable, like a premature baby or if they have special needs. So this bonding, which we're going to get back to later, is really important. It involves strong, loving connection that forms as parent hold, examine, talk to, and feed the newborn. Early skin-to-skin contact is not essential for human bonding, but it sure goes a long way in helping bonding. And this is just an example of a type of bonding that happens in Manila, Cebu in the Philippines, called kangaroo care. It not only helps the baby, but it helps the mother. It helps the hospitals. They save space, and the cost of having children and raising them goes down. So that's a quick overview of the chapter on prenatal development, and on to chapter 5.